Hey John, thanks for coming in to see me today. I know that you've been having a hard time dealing with your asthma this season, and so I wanted to talk to you about our options for treatment for you and just give you a better understanding. I know that the last time we met, you had a lot of questions about the medicine you're taking, how it helps your asthma, the possible effects from your asthma medication, and how it's going to help treat your asthma. So I'm just going to try and simplify all these questions as best as I can to get you to kind of understand what's going on. So first off, when you have an asthma attack, your body naturally tries to resolve the issue on its own. When an irritant is brought into your lungs and the inflammation process begins, your body increases its mucus production. This mucus production is really actually quite beneficial for us because it's a way to coat the airway, which helps us protect it from exposure to another incoming irritant. The second way that your body tries to protect the airway is by constricting the size of the airway. So, initially, your airway is a pretty normal size, but when we take the medication, or your body tries to just close up that airway. However, this can cause a really big problem for us because there's a decrease in the volume of air exchange between your lungs and the outside environment. Okay, so I hope you kind of got that much. Now that we know a little bit about how our body is naturally trying to protect us from an asthma attack, I think it's really beneficial now that we talk about how your drug is helping you, um, you know, handle your asthma attack. It's important that we look at the severity of a drug, the frequency of your exacerbation, so actually how many times are you having these asthma attacks, and the convenience of a drug before we actually prescribe you a drug. Again, we're not going to prescribe that drug to you, but our team doctor is going to make sure that he looks at all these factors before he actually gives you a drug that you can take. There are two different type of drug classes that he can look at, and it's going to be your bronchodilators and your anti-inflammatory drugs. But in your case, and since we had a lot of questions for you about your own drug, we're going to focus on the drug that was prescribed to you. So you have a beta agonist bronchodilator. Your beta agonist based drug is beneficial to your asthma case because they're fast acting and they provide you a quick relief from all your symptoms. The beta 2 adrenergic bronchodilators specifically targets the beta 2 adrenergic receptors. So when they attach to these receptors, your beta 2 receptors, they cause relaxations, which means your bronchioles dilate and then now more air can get into your lungs. The second factor to consider is the length of a chemical chain. And I know you don't really see too much of this, but the length of these changes can really determine how long the drug will have an effect. So if it's a longer chain, that means the drug effect is going to be a lot longer than a shorter chain. And that's something that you might really want. You don't want to have these symptoms going on too long. You want them to resolve them for a long duration of time. You've probably mostly heard of albuterol in the use of asthma, and that's again a short duration drug, and so it's called a rescue drug for typically used for rapid bronchodilation and as a prophylactic treatment to prevent respiratory complications. Again, there's two different types. So there's the short-term drug use and then there's a long-term. But in our case, albuterol is typically more common. It's what you're taking. So with a medication, obviously there's always going to be some side effects to taking a beta agonist drug like nervousness and restlessness, trembling, throat irritation, and potential hypersensitivity. But just because these are all side effects from the drug, it doesn't mean that you're going to experience all of these, and you might not have any of these drug effects. Now that I've kind of briefed you on everything, I hope it answered some of your questions and you were able to see what your medication is actually doing for you. I think that moving forward, because your episodes of asthma are pretty sporadic, that we can continue to use the albuterol as a drug to treat your asthma because it works short acting, and who knows, if we needed to, we can always get you a better drug that works on long-term effects. But for now, I think it's really beneficial that we continue using the albuterol as a form of treatment for your asthma. If you have any other questions, John, please let me know, and I'll always help you to try and answer any other questions on any medication you're taking.